Hello, everyone, and welcome to November. I'm Nanette Whitman-Holmes with Bridges, Helena Community Connections, and I am here today to present this month's Cranium Cafe program. These talks will be posted every month on the Bridges website found at bridgeshcc.org or on the Bridges Facebook page. I will also send out a Cranium Cafe Brain Builder packet of fun puzzles that look like this to anybody who requests them, either by sending us a message through the website or through Facebook via Messenger with your name and address. Please rest assured that we are not selling your information to anybody. You're also welcome to pick up a Brain Builders packet at Covenant United Methodist Church, located at 2330 Broadway, across the street from St. Peter's Emergency Room. The Brain Builders are in a container placed on the left side outside of the front entrance of the building. Now, our Cranium Cafe talk today is based on the book Welcome to Your Brain by Sandra Ament and Sam Wang. Today's talk is titled, let me bring it out here, Did I Pack Everything? What you want to know about anxiety. Now, I'm not trying to make you nervous, but the truth is that being too relaxed can actually kill you. Now, in a world filled with hazards, worrying can offer big advantages for survival. Of course, it is possible to worry too much. For instance, if you're a badger who's too fearful to leave his den to find food or a mate, you're not going to survive. It's also possible to worry about the wrong things. Like when a person develops a phobia that turns entering a dinner party into a heart-poundingly scary experience. On the whole, though, anxiety serves many useful purposes, and not just in leading us to exercise caution in the face of danger. Anxiety also motivates positive behaviors, from finishing an assignment before the deadline to storing enough food to get through the winter. Ironically, emotions that make us feel bad often cause us to behave in ways that are good for us, which is why they have become so common. Although everyone experiences anxiety, people and other animals too show individual differences in how easily their anxiety is triggered, how intense it is, and how long it lasts. Some of these individual differences are due to our genes. Having a relative with a panic disorder, for example, increases your risk of developing the disorder by a factor of about 5. Now, genes not only control baseline anxiety levels, but can also determine our sensitivity to life stressors, such as child abuse, the death of a parent, or divorce. People with a protective variant of a particular gene, for instance, can handle a lot of tough events with little chance of getting an anxiety disorder or depression as a consequence. This gene encodes the serotonin transporter, which removes the neurotransmitter serotonin from the synapse after it has done its job. People with the vulnerable variant of the gene are more sensitive to stress, but they can get along fine if nothing too bad happens in their lives. People with one copy of each variant, because we all have 2 copies of every gene, as you can recall from your high school science, those people fall somewhere in the middle. They can handle 1 or 2 bad events, but multiple bad events may send them over the edge into depression or into an anxiety disorder. Now, anxiety disorders are the most common type of psychiatric disorder in the United States, affecting about 40 million people. As many as 90% of people with anxiety disorders also have clinical depression at some point in their lives, and many of the same treatments are effective for both problems. For example, selective serotonin reuptake inhibitors like Prozac, which are commonly used to treat depression, also work well for anxiety disorders. This overlap suggests that the brain mechanisms that cause depression and anxiety may be similar, though the origin of abnormal anxiety is better understood. As we have already learned in previous talks, Damaging of the amygdala in your brain interferes with fear responses and fear learning in humans and other animals. Stimulating the amygdala produces fear responses in animals. You do not need a brain scanner to tell you when your amygdala is active. It's happening when your heart races and your palms get sweaty, your blood pressure goes up, and in extreme cases, you might find it hard to breathe. These symptoms occur because the amygdala has a direct connection to the hypothalamus, which controls the body's stress responses. Amygdala activity leads to activation of the sympathetic nervous system, that fight or flight response, and release of stress hormones. People who experience intense and acute onset of these symptoms are said to have panic attacks, a type of anxiety disorder that can produce symptoms so overwhelming that people believe they're about to die. An overactive amygdala probably causes some anxiety disorders. Other patients seem to have normal amygdala responses. Instead, they have a problem with their prefrontal cortex, which is responsible for turning off anxiety when it's not appropriate for the situation. The amygdala, which is in the middle of your brain, receives input directly from the senses, so its responses are designed to be fast, but not necessarily accurate. Often, further analysis by a more careful part of the brain leads to the realization that there's nothing to fear. One example might be if you saw a snake, but it turns out that it was just a branch on the ground. The prefrontal cortex then inhibits the amygdala, shutting down that anxiety. If this process isn't working correctly, people will continue to feel anxious long after the danger has passed. Some of the best treatments for anxiety disorders probably work by increasing the effectiveness of this inhibitory pathway. Mild anxiety shouldn't require professional treatment. If you want to try the self-help approach, start by thinking about how to reduce stress in your life. You can do this in two main ways. Number one, reduce your exposure to stressful situations or learn better skills for coping with them. Which of these approaches is most useful will depend on what's causing your stress. One good way of living more comfortably with stress is to exercise regularly, preferably at least 30 minutes every day. Exercise improves your mood, and as we've learned before, it also has the added benefit of helping to preserve brain function and reduce the risk of dementia as you age. So there's really no downside to exercising. Meditation may also reduce some stress responses. Some people find that yoga is particularly helpful as it combines exercise with mental calming. You should also try to reduce your caffeine intake and get enough sleep. Resist the temptation to medicate anxiety with tranquilizers or alcohol, which will only make the problem worse in the long run. Many people with anxiety also suffer from substance abuse disorders. If these techniques don't reduce your anxiety, or if your anxiety causes serious problems in your life, you might need to see a professional therapist. Two types of psychotherapy, which are often used together, have proven to be effective for anxiety disorders in clinical studies. Both approaches are short-term interventions that concentrate on teaching patients to control situations that make them anxious, and both require active participation from the patient. Behavioral therapy is based on extinction learning, which means you have repeated exposure to a feared object or situation without negative consequences that result in extinction. This process is the one that teaches animals or people not to fear a stimulus. Behavioral therapy focuses on helping people to stop avoiding anxiety-provoking situations so they can learn that these situations are not really dangerous. Cognitive therapy focuses on helping people to learn how their thought patterns contribute to their discomfort and to substitute more productive ways of thinking about the problem by distinguishing between realistic and unrealistic thoughts, for instance. Before you see a therapist, you should make sure you know what type of therapy he or she practices and whether it works for the problem that you want to have treated. Doctors are testing some exciting variants of these approaches for treating anxiety disorders, though these new treatments are not yet widely available. Because the demand for behavioral therapy exceeds the number of trained therapists, some researchers are working on computer systems that allow people to control their own exposure to anxiety-producing situations. Another approach is to expose people to a simulated version of the situation. Doctors have used virtual reality therapy to treat phobias, panic disorders, and PTSD. Preliminary evidence suggests that it may be as effective as direct exposure to the fear-triggering stimulus. In one particularly exciting new approach, doctors ask patients to take a drug called D-cyclocerin before virtual reality behavioral therapy sessions. This drug activates receptors in the brain, which are important for learning. By improving learning, the drug increases the rate of fear extinction. Learning that fear extinction that's learned during behavioral therapy. Patients in this study showed reductions in anxiety after as little as 2 sessions, and the improvement lasted for 3 months. This group is now testing the same approach for treating PTSD in veterans of the Iraq War, who have an 18 to 30% risk of the disorder. If these treatments live up to their promise in further testing, it might be possible to greatly decrease the number of people who struggle with excessive anxiety. Of course, we can't expect to eliminate anxiety altogether by using any of these techniques. If that happened, we would never get anything done. There's definitely an optimal level of anxiety. Not so low that you lie on the couch all day, but not so high that you huddle under the bed in fear. And unfortunately, the best level for survival isn't necessarily the one that makes us feel most comfortable. But if anxiety is interfering in your life, I strongly encourage you that you do something about it. Don't let a problem with anxiety take control of your life. That was our chapter for this month, November. We'll be back in December with another program, and we hope that you enjoy all of these. Again, visit our website, like our Facebook page, and if you would like the Brain Builders packet sent out to you, send us a message and we'll get one sent out this month. Have a happy November.